Bueno, pues esta es la clínica donde hace solo 9 meses me operé. Como veis, parece más un hotel de 5 estrellas que una clínica. Y vamos a conocer al Dr. Balwi porque lo vamos a entrevistar para el episodio del podcast de hoy. Así que vamos a por ello. Hoy será un episodio en inglés.
Frogmación Podcast.
Capítulo 125. Entrevista al Dr. Balwi, el mago detrás del milagro del trasplante capilar.
Muy buenas a todos y bienvenidos a un nuevo episodio de nuestra evolución del trasplante capilar en la clínica Elithair aquí en Turquía. Estoy ni más ni menos que con el Dr. Balwi aquí, responsable jefe de la clínica. Thank you very much for attending me today.
You are welcome, sir, every time. We are happy to see you again after 9 months with the new look, with the new hair. You changed completely. You are a completely different person now.
Absolutely.
I'm happy for you. Your result is amazing. Actually, it's not the final result. It's about 75-80% of the result because the last result will be in the 1 year. So now we are in 75% of the result and it's look very natural, very dense, and it's amazing. I'm happy for you.
No, and all thanks to you and your clinic,
welcome.
of course. I wanted to introduce you to the audience because the people in the channel, they always ask me, hey, but is it Dr. Balwi that intervenes in the operation and all that stuff? Or is he real even? So that's the final confirmation that you're real. And I wanted to ask you, why did you want to start a business like that? Is it because when you were younger you had problems like me? Or is it because you want to contribute to the society, to the beautiful of men and women?
Let me take the mic, please.
Yeah.
Because it's going English.
Yeah.
So actually, before I started hair transplant, I was thinking about the organ transplantation. I was thinking to go for USA and I was prepare myself to go for USA. Actually, I prepared the first step of United States medical listening examination. And after that, I know that it's in 2010. I know the hair transplant from my teachers in the medical school. I almost finished my school in 2010. I prepared myself to go, and one of my teachers in the school in dermatology asked me, Abdulaziz, can you come with me and help me in the hair transplant because I know also Arabic language and the patient was coming from Arabic country.
Okay.
I go with my teacher and I see the hair transplant the first time in my life and I like it. And after that I asked my teacher, can I learn this work? She said, yes, okay, why not? If you want, come with me daily and you can learn it. And I start to learn it. In the same time, I was preparing myself to go for USA, to continue in general surgery and organ transplantation. Day by day, I start to like this job more. And after that, I like it so much. And I cancel my planning in USA and I decide to stay here in Turkey because of the capital in the world for hair transplant is Turkey. So I canceled going for USA and I decided to stay here and continue in hair transplant. I like it so much. I do it because I like it actually, as I told you. Yes, I was having that years, I was have hair losing, so I can understand what the patient's feeling. Mm-hmm. In that time I was I think 25, 26 years old and my hairline started to go and it was a big problem for me. And when I do my first operation in 2011, I was 26 years old because I lost just the front hairline and it was a very big problem for me actually. So I can understand every patient who have this problem. Mm-hmm. And I can understand what they are feeling. So this is maybe the reasons I like hair transplant and I feel this operation is very important to change the life of any person.
Yeah, absolutely. And in fact, it's not only the hair transplant because after that you do a lot of supervision of the whole process during the whole year and to make sure that you take the pictures every month, you take minoxidil or PRP or whatever. So basically it's a whole process behind the
operation. Sure, yeah. The beginning of the process is hair transplant.
Yeah. What would you tell to these people that hesitate to come here to Turkey to do a hair transplant or not? Because there are a lot of people that tells, is it painful? I don't want to go there. Will it hurt me? Will I have problems in the future because I need to take some medicine? What would you tell to these people that hesitate?
The operation in last years, it started to be very, very easy actually. Especially in Elithair, we can promise any person in zero pain. I mean zero pain. So because we can make, as you know, in every patient, we can make 5 minutes deep sleep.
Yep.
And during these 5 minutes, we make the local anesthesia. And after that, the patient woke up and can't remember the local anesthesia. And all the operation, they feel zero pain. So the operation is very easy now, fast, easy, no pain, zero pain, and very comfortable. In Turkey, if they decide to come into Turkey, just I recommend them to make good searching because there are very good clinics in Turkey and there are also bad clinics. Every place in the world, in Spain also, there are good clinics and bad clinics. So they should make good searching. They going for hospitals. They should go for hospitals, not for small clinics. They should find the doctors. They should be the person who will make decision in the operation, who is doctor. They should check the certifications of the clinics, of the doctors, of the team, something like that. So I recommend them. I want to tell them it's very easy. Don't worry. Turkey is very good place for hair transplant. And after operation, the caring of the operation is very easy. Just you need about 8 days to make daily washing of the hair, and after that, nothing. Actually, not all the patients like you use the spray after operation because you have big area here not implanted and you want to save your existing hair. This is the reason that you use minoxidil daily. But just about 5 to 10% of the patients use spray after operation. So it's not necessary to use all the patients to use the spray after operation. So the caring after operation is very easy.
Nice. Also, one of the things that I looked for when I decided to come here to Elithair was all your trajectory, that you keep investigating on the area, you have a lot of research on that stuff, and you have the latest technology, the neo-few and all these things. You want to explain how this evolution has been during the last 10 years in your field?
Actually, it's last 14 years. It's not last 10 years, it's last 14 years. So this coming when you have a target, when you want to be the best for your patients. So my target every time, find the best to give our patient the best. This is our target every time because we believe that our patients should have the best. So every time we have searching, it does not know your food. We have a pre-test system. It just in the world in Elithair. We have 6 different kind of the tests we do for every patient before the operation. In all the clinics, they implant the grafts. For example, they don't know in which layer in the skin they implant. But for example, in Elithair, we make ultrasound and we check the thickness of the skin and we decide in ultrasound in which deepness we will implant the graft. So it's give more survive for the grafts and a lot of things. So this survive coming slowly by times, day by day, month by month. But I can't now in 5 minutes explain how it's coming in 14 years, but I can tell you the reason of this things that we find. The reason is we want to give the best for our patients.
Nice. And also, one of the things when you decide to come here is that you're able to speak the language, because probably most of the people that don't come here, they don't speak Turkish. But as you can see, we are able to talk in English, but also we have very good people that translate for us. And in our case, if you want to come here to the video,
Hola.
ella fue la responsable de guiarme durante todo el proceso en castellano, y cualquier pregunta que el doctor me tenía que transmitir me lo tradució totalmente en castellano, así que podéis estar seguros que estáis en buenas manos.
Sí, gracias. Estamos esperando.
Genial. I'm just saying that they are in good hands, that if they even don't speak English, they have Spanish
Yeah,
translator.
we have in all the languages actually. Portuguese, Jenny, there?
Portugués.
Yeah, Portuguese, Spanish, Italian, French, English, Arabic, and
German.
German. We have 8 different languages here. And sometimes some of the patients coming from Japan, we don't have Japan translator, so we work also as a freelance with all the languages. For example, one of the patients decide to coming from China. We don't have, because we don't have Chinese patients here, but for example, in 2 months, one patient coming from China, we can bring translator as a freelance. But in our staff, we have 8 different languages.
Oh, that's amazing, because how many people work now at Elithair?
520.
520, that's a lot, that's insane.
Yeah.
I mean, it's like a big company already.
Yes, in Estambul, in Turkey, the biggest hair transplant clinic or hospital in Turkey. When we say it's the biggest in Turkey, it means it's the biggest in the world.
Yeah.
Yeah.
Makes sense. And also, how many hair transplants can you do in 1 year, for instance?
Daily we can make 100 operations.
100
daily.
operations?
100 operations daily we can make.
That's a lot, that is insane. Yeah, and the customer satisfaction, if you look at the website,
Yeah,
is
we are
also
very big
super
team.
high.
Yeah, we have very big team, but it's like askeriye ne demek? Askeriye. İspanyolca.
Evet hocam.
I don't know it's in English, so maybe she can explain in Spanish.
Bakabilir miyim?
No pasa nada, fallos del directo, no pasa absolutamente nada.
Un momento, solo un momento.
Like soldiers, I think. You know, in soldiers we have onbaşı, yüzbaşı.
Militar, el militar.
Rangos.
Yeah.
Sí.
So, in big team, you can't control if you don't make like military. You understand me? So, we have here 7 teams. In every team, we have teams. So, control, under control, but we have main 7 teams. So, in every team, we have main doctor, main anesthetic team. You understand me?
Yep.
So in this way, we can manage this big team, and we can make 0 mistake. How you can make 0 mistake? Because in Elithair, every person make just one job. You know that, for example, the cars factories, every person make just one job, so he can't make mistake in just one job. Here in Elithair, in hair transplant, the person who make FUE just make FUE. There are 7 departments in the operation. Every person work just in one department. He made just his department daily. In this case, 0 mistake and very, very, very high experience. In another clinics, all the operation done with 2 person or 3 person. So in another clinic, in 99 of the clinics in the world, the same person make FUE, make microchannels, make implanting, make blah blah blah, local anesthesia and different. But in Elithair, the person who make local anesthesia just make local anesthesia, so he can focus in his job and he will have very high experience. The person who open microchannels or the persons who implant with DHI implanters who make just this job all the day. You understand me?
Yeah. I mean, at the end of the day, it's
So
like
we
a
believe in
company.
specification.
Yeah.
We believe also in education. We have academy here. We have academic system here. So we have the person who start with us, the nurse or doctor, he had minimum at first 6 months asistanlık dönemi diyoruz biz ona. As
Yes, an intern.
like intern, 6 months. During these 6 months, daily they have license. That's
Un estudio.
yeah. Daily they have at morning. The teachers coming, and so we have academic system here. So in this academic system and researching and very good management like military, you have very high quality and 0 mistake.
Oh, that's amazing, because at the end of the day, it's like a company, basically.
Yeah, it's very big company.
Yeah, it's amazing. So, any final words you want to give to the Spanish audience that are hesitating to come?
Yeah, actually we like so much the Spanish people, really, because Spain is very different for me. Spain is a special country for me every time. Every time I say, if I living in Europe, I live just in Spain. Maybe the second country is Italy, because the Spanish people work and know how they can live. I stayed in Salamanca 1 month. When I was studied in Ege University in Izmir, Our university sent every year 3 persons to Salamanca University, and Salamanca University was sent for our university 3 students. Our university sent the first 3 students, and I was in the first 3 students. So they sent me for Salamanca, and it was very different 1 month in my life. And this 1 month, I have a lot of Spanish friends. I see from news how they live, how they work, they are disciplined, and they can live. So I like Spain very, very much, and I like the Spanish people very much. They are welcome every time. We will give them our best. They can be sure they will be in safe hands, and they will have 100% the best results.
Pues ya lo habéis escuchado, en manos directas del Dr. Balwi, os lo ha contado de primera mano, así que para todos los que dudáis si venir o no venir, pues os puedo garantizar que estáis en buenas manos y the best result is this. I mean, at the end of the day, this is the proof people need, isn't it?
Yeah, I will come every time, and all our patients from Spain, they are welcome.
Thank you very much. Pues estáis bienvenidos aquí en Elithair, en Turquía, en Estambul, así que todos los que dudéis, os dejaré los datos abajo en el vídeo para que podáis contactar con la clínica del Dr. Balwi y veniros aquí a poner pelo como hice yo mismo. Hasta la próxima.
Bye bye.
Y bueno, después de la visita express a Elithair para conocer al Dr. Balwi, ya estoy en el hotel. Solo por comentar algunas cositas de las que me ha comentado fuera de cámara. Se ve que, bueno, lo del trasplante capilar en mi caso fue todo un éxito, que incluso me ha dicho que solo estamos al 75% del proceso, por tanto que aún cabe esperar de que el pelo me crecerá entre un 20 y un 25% más, tanto en densidad como en cantidad, por tanto, escucha, nada mal. Y lo segundo, que bueno, como la zona que me trasplanté es la de adelante, esta está cubierta, pero que en los hombres tenemos una segunda zona peligrosa, que normalmente nos solemos quedar calvos, que es el cartón, ¿no? La zona esta de aquí. Que me ha dicho que en mi caso, pues normalmente, ¿veis? Cuando pasas la mano se cae un pelo o 2 pelos, no sé si lo podéis ver, está en mi mano. Y que es algo que hasta los 50-55 años puede seguir perdiendo densidad capilar. Entonces me ha dicho que me lo siga cuidando, que siga con las medicinas que me recetaron en su día, minoxidil, finasteride y algún PRP de vez en cuando, sobre todo para prevenir, ¿vale? Para prevenir. ¿Qué significa prevenir? Que si en estos 15-20 años pues la densidad no baja por prevenir, pues me ahorraré un trasplante adicional en esta zona, y que si no, pues lo más normal es que de la misma forma que de la zona de adelante perdí bastante, también pierda en la zona trasera. Pero bueno, me ha dicho que está muy contento del resultado, me ha visto, y además me ha visto con estos pelos, que vengo de clavarme los vuelos y no había pasado todavía por el hotel, acabo de llegar ahora al hotel. Así que me ha visto con estos pelos, pero ha quedado encantado, ¿eh? Pasaba las manos varias veces, además me ha dicho, te ha quedado muy natural, no se nota la línea de antes, la línea de después, el pelo súper suave, muy bien arraigado. Así que espero que, bueno, los que dudáis, pues yo creo que no podía haber mejor persona que os contara de primera mano qué es un trasplante capilar, por qué se metió en el mundo de los trasplantes capilares y cómo gestiona la clínica de Turquía. Ha dicho más de 500 empleados, se dice rápido, y 100 trasplantes al día. Es mucho trabajo, Fijaros que el nivel de experiencia que gestionan aquí es que es brutal. Es que es brutal. Y como muchos me lo habíais pedido en los vídeos que voy subiendo de cómo ha evolucionado mi pelo, yo creo que era el candidato perfecto, ya que volví aquí a Estambul para las charlas del Gaming Estambul, que entrevistar al Dr. Balwi, a pesar de que la entrevista, bueno, ya habéis visto que ha sido en inglés, pero creo que es bastante sencilla de entender. Si no, recordad que creo que YouTube tiene una funcionalidad para activar los comentarios y que os lo suele traducir al castellano, ¿vale? De todas formas, si hay alguna cosa que no ha quedado muy clara y queréis que la dejemos más patente, en la cajita de comentarios me ponéis, oye Juan Gabriel, ¿qué decía en este momento? He entendido esto, pero ¿iba en esa línea o no? Y sin problema os lo responderé, ¿vale? Pues oye, un capítulo diferente. Ya os dije que en esta temporada del podcast quería explorar formatos diferentes y sobre todo aprovechando que en los viajes conozco a gente muy interesante, y en este caso me habían invitado a volver a la clínica para hacerme una revisión de cómo había ido el trasplante capilar. Pues hemos aprovechado y hemos grabado un episodio del podcast totalmente diferente. Si este formato te ha gustado,
pues porfa, déjatelo en la cajita de comentarios porque así ya sé que cada vez que vaya de viaje y conozca gente interesante, pues vale la pena que les entreviste, a pesar de que muy probablemente las entrevistas no serán en castellano, sino que serán en inglés, ¿vale? Pues bueno, espero que hayáis disfrutado mucho del episodio. Yo tengo unas ganas ya de echarme un ratito, porque luego en unas horitas vendrá Bora y vendrán Tolgay de viaje. Me han dicho que me iban a llevar a algún sitio aquí a tomar algo, así que la noche turca me parece que va a ser un poquito larga en el día de hoy. Os veo la semana que viene con otro episodio y espero que este os haya gustado tanto como a mí poder volver 9 meses después a la clínica de Elithair en Turquía.
Si te gusta Frogmación Podcast, síguenos en redes sociales, a través de Facebook, Twitter, Instagram o nuestro canal de YouTube. Y consulta todos nuestros cursos o suscríbete a nuestra newsletter en la web frogamesformacion.com.